Hey, hi, it's Dr. Buford. Just getting started on the left shoulder, looking in from the back to the front. Everything that you see is magnified 30 or 40 times on the screen of the camera. We're just going to put in the shaver here. It helps us probe some of the structures and smooth out any rough areas. And this is your biceps tendon on the, kind of in the middle of the screen, just behind the shaver. And the anchor site looks okay here as well. The rotator cuff tear is what's behind it, this torn tissue here. This is all part of the torn rotator cuff, so we can trim this out a little bit so we can see exactly how big of a tear we're dealing with here. Okay. And as we look up, we can see how that tear extends up here. Before we do anything with that, we're going to have a good look around the rest of the shoulder, inside the joint here. We'll rotate the camera, look down the front. That anatomy looks pretty good. You can see a little bit of arthritis on the glenoid side of the joint. Reach in here and trim this out a little bit. There's another central area here. But by and large, that's not too bad. And then in the back of the shoulder, this looks pretty good as well. Okay, so we've got actually a pretty good sized tear to deal with here. We'll go off on the video and show you some more in a little bit. Pause, please. Okay, so here's this tear we're dealing with. It's a big tear, a medium-sized tear. You can see the hole right here. We'll look back to the right. You can see the tear stops right about there, so we're going to put an anchor way back here. It's going to be 2 anchors. And we'll get started here. The first thing that we need to do is take a spinal needle and check our angle. Make sure we get a good angle down into the bone here. And we'll get this first anchor in right about here. So we'll make a little nick in the skin. And then we're going to place an instrument called a punch right there. We want to confirm that we're getting back as far as we want to. That looks pretty good. So we're going to place our first anchor right about here. We'll get our super shuttle, which is an instrument we use to pass suture back and forth. So now we'll unload the screwdriver and then we'll show you that super shuttle. Okay. You can see those different colored sutures we have to work with. We'll reach in here with our, what we call our crochet hook, and spread these apart. And we do this in order to decide which ones we're going to work with first. So we're going to start with the blue and white one. Take it out right here on the left side of the screen. This instrument that you see there, that's called a suture hook. This is what allows us to pass the sutures back and forth through the tendon. So we're going to grab the tendon here, we'll look back here. Thank you. And we'll take this first stitch way down here. Down low. That's pretty good. And then we'll go ahead and feed that through. Bring that out. We'll load that with that blue and white suture. We'll show you that on the video here. Pull back. There it goes. And it comes out right there. We'll pull in, or reach in and pull out the partner suture here, and we'll tie this knot. Because this will give us a good anchor point. gives us our first anchor point. So now we're going to work with the next suture in line. Which as we push in here, we're going to spread these apart. We're going to deal with this black and white suture next, right here. Okay. And looks like we can use that straight one again. Make sure we get any deeper. I think we've got it all here. Get it down. So we're going to bring this one in right about here. Again, trying to stay posterior on these first two sutures. There it is right there. Pause, please. The second anchor with the second set of sutures we can use. We will spread these apart and decide what order we're going to pass them in. We want the one farthest to the right, which looks like at this point this blue and white one. So we'll reach in here and take this one here. Just like that. Okay, very good. And now we'll take our next suture hook, which is this one here. We're going to take this tin and we want it to sit down like that. Look back here, right? So we're going to put this right about here. Get this past and show you some more in just a minute. Okay, we're all done. We've got this tear completely repaired. So we've got the first set of 3 sutures right there. You can see them on the screen. And then the next set of 3 right there. So we've got 6 sutures holding that tendon down to the bone. Okay, that's all the way up to the rotator interval. So that looks real good. We're going to finish up here in just a minute and get you back to the recovery room, okay? So good luck to you now. Bye-bye.